Hello, and welcome back to another episode of the Starbright podcast. No major news or any updates on anything this week. We're just going to get straight into the episode. I think Drow is going to be here a little bit late, but he will be joining us. We will have all four of us here today, which is for anyone that does not remember, the topic is disability. I would say disability accessibility in kink is basically what I said. So it's all about just
I would
pretty much
say not even
that aspect.
necessarily disability, but the accessibility in general. You don't have to be disabled to benefit from making kink more accessible.
That is very true. That is very true. But as I said last week, I think this is hits closer to home. I think to you, Mouse. So I was going to let you
Yes.
lead this one. So what would you like to talk about first?
Well, this was something that came up during the last podcast. We were talking about things that were maybe a little bit difficult to get into, or things that tools in the dungeon that actually would have been beneficial for people who are disabled to help it be more accessible. Things like sex swings, couches, and things like that. But I think a large part of what I have found over the week as I've been thinking about, ways to make kink accessible is how it's very difficult person to person to do the same things that necessarily everyone else is doing. People have different anatomies, different flexibilities, different strengths, different weaknesses. And a large part about kink, and I think a real strength to our community, is that we not only acknowledge this, but we're very, very good at coming up with ways to make things work. And I think that that is something that is really important to discuss about, especially in terms of things like disability, where somebody may have, a physical disability that causes them to not be able to move in the same ways or breathe in the same ways or even have sex in the same ways. I think that's already something that we do a lot in our community in general. But I think that the ability and the understanding that we can and should implement this in a way to make it more accessible for people with disabilities and not be exclusionary is really important, that we discuss it, that we understand how this works and what to look out for. And I was actually pleasantly surprised in the last 2 weeks that I've been looking how much information is actually out there discussing it. Not all of it was good information. I will add the caveat that not all of it was something that I was very impressed with. Some of it I thought did have some ableist undertones. But there is a lot of information out there, and I know Kat and I were talking about it before we started. There's a lot of information that's out there that I think is really beneficial for not just disabled people, but for all of us to make things more accessible to people with different limitations. And I think that the big thing is that disabilities, we're not just talking about physical deformities or physical limitations or things that would be like a physical hindrance. We also have to talk about things like understanding difficulties and how to make consent reasonable and accessible to everybody. But in doing so, I think it also makes it really helpful to those of us who are neurodivergent to begin with. Clarity, like the clarification of consent, is I think the biggest take home when I was looking at what is important when it comes to accessibility and the crossover with disability and accessibility. I'm rambling a little bit here because my brain's going a million miles a minute trying to think of all this. But the big thing I was looking at that I thought was really important is it's hard to consent to something when you don't actually understand the implications for it. We've talked about this before with the consent frameworks such as RAC and PRIC. And the biggest thing is you have to have informed consent. With disabilities, especially wherein your body is going to react differently to things, it's very hard to have informed consent as to how this is going to work on your body without having tried it. So it's something that is a little bit riskier, but something we have to be very explicit with, especially when it comes to disability. I am consenting to do this knowing that we don't actually know what the explicit risks for me personally will be. Like for me with my disability, which is an immunodeficiency, I don't actually create immune cells. If I were to try to get into blood play, there's no possible way for me to consent fully to know all of the possible ramifications without, having forethought on this. Like I don't necessarily know that whether or not this is something that could be potentially a huge issue that I could end up with like a catastrophic blood infection. I don't know. So I can consent to it, but I can't really say I have a full understanding of the risks that are involved, if that makes sense. And I think this is something to bear in mind, especially with the intersectionality with disability, is consent becomes a lot trickier and something that we have to become very explicit about and very clear that there are different risks inherent with the process of BDSM and kink, with different abilities and different situations and different bodies and different anatomies than may exist for people who are fully abled and have no limitations in this way. What do you guys think?
Yeah, I mean, I'm assuming that would probably be, depending on what kind of disability someone might have. I would think that would be one of the first things they'd probably should do if they're trying to get into something that could be risky, is try and find out, as much as you can what those side effects could be, what the risks are. And then, but yeah, I mean, you never really know for sure. I mean, and then
Yeah,
that's true technically for like fully abled people too. Like you might not know you have a heart condition
correct.
until someone's flogging you, and then all of a sudden,
Exactly. Exactly. And this is another really important thing. And I say this all the time in chronic illness communities. Health is not a moral construct that you have because you try really hard to be healthy. That's not how health works. Health is only ever a temporary state of being. You are healthy as long as your body stays healthy, and there's no guarantees as to how long that'll last. And you won't necessarily know that you've had a change in your health until you've had a catastrophic change in your health and suddenly are having a heart attack or are suddenly having a medical emergency that you could not have possibly foreseen because you had no idea something had changed. So it's very important. We were talking about this earlier too with the safe words. You don't need a safe word up until the moment you need a safe word. Just because you've never needed one before, just because you've never had to call a safe word, just because you've had a high tolerance for everything you've experienced, does not mean that you will not come upon a situation where you are having a medical emergency, you know something does not feel right, and you need a pause. So, safe words are one of those things that are just of the most paramount importance. And I cannot possibly underscore how important it is to, even if you don't think you need a safe word, have an established safe word. Because you never know when something could go wrong. Just because you're healthy and you've never had an issue yet doesn't mean that it will not.
I've always thought about that, something like people who are like seriously allergic to something. Like if you can afford an EpiPen, and I know that's a big if for allergies, but
Oh,
the
yeah,
the, the allegory stands. If you can afford an EpiPen, why would you not carry one with you? Because you're not going to need it 99.99% of the time, but as soon as you get that allergic reaction, you're dead if you don't have it
sure.
with you, and that same risk
Exactly.
carries true even in kink. Safe words is it's just standard preparation. You should always have that
Hmm.
in case you need it. Hopefully you never will. Maybe you'll even forget
Exactly.
what your safe word is unless you think about it every once in a while. But
Which
like
is
it is
why we
much
should
better to still
discuss
have
it
that and be prepared.
often.
Very true.
Exactly. I think there's another metaphor that I think is really important here too. I like to say you don't wear your helmet for the days that you're bored and it's just a leisurely drive and you wonder to yourself, why do I even bother wearing this? I've never needed it. You wear it for the one day that something goes catastrophically and unforeseeably wrong. Because that's when people die. They die in these horrible biking accidents, just freak accidents that no one could have possibly foreseen. But if you are already in the habit of wearing a helmet, that risk of that happening is so much lower. At least if you have an established safe word, you know if something goes wrong, you have a way to communicate it. You have a little bit more of a safeguard that you're not reliant on your partner to know when you're feeling or know when something's off, because your partner is not a mind reader. They may know you very well, but they may not understand that the way that you're wiggling isn't just because you're uncomfortable, it's because you're scared, because suddenly you can't feel your left arm or something. And if you don't have a way to communicate this, with hand signs or safe words or something, that could very quickly turn into a medical emergency for which there is no way to not have permanent, lasting side effects. This is such an important topic. And especially now that we're talking about accessibility, especially within accessibility as a discussion, we need to be very well aware of how critically important safe words are. Because you never know when something can go wrong, and you need a way to have every party involved have a way to back out and reassess.
Yep, definitely 100% true. And it's part of the preparation. I mean, I would say I would argue that that is like inherently a part of all those different styles of education on kink that we've talked about, prick and rack and
Yes.
whatnot. Like that's something that is you can't. What would be a good way to say this? You can't like
I don't think it's possible to fully consent to kink unless you have these safety plans
exact
in place.
right. That's exactly what I'm trying to go for.
How can you have consent if consent cannot be revoked? Because at that point, it's no longer consent. It is just abuse with a different name. I just don't understand the concept of thinking that because somebody said something was okay once, that they're going to continue to be okay with it in perpetuity. Consent is so important. And one of the biggest and most pivotal parts of consent is consent can change and should be able to change. Nobody should be locked in just because they agreed to it a little bit ago. If suddenly something happens and they realize that they no longer feel safe, that something is happening, their body does not feel right, they are scared, they need to have an out. And there has to be an established way for them to say that they have an out. Whether that be the sub, whether that be the dom, everyone needs to have an escape route, or you are not practicing safe kink, safe BDSM. I don't think it's possible to say that you're practicing safe BDSM if all parties involved do not have a way to back out when something is wrong.
Yep, absolutely. And the more at risk someone is physically, the more important
Yes.
that becomes.
Yes, and that is something that I was running into frequently while I was looking into this, because some of the things that really struck me as ableist were discussing how, specifically, one of the things I ran into was fetishization of disabled individuals. I think it's called devotees. I wasn't super clear on this. I think I probably should know, but I don't remember. But as I was going through it, one of the things that I ran into was a lot of talk about disabled people as being hypersexualized, which disabled people are not sexual by nature, but to hypersexualize us is also just weird. Like, not all of us are consenting to be hypersexualized just because we're disabled and vulnerable in ways that not everyone is. But that's a different discussion. But there was like this understanding that that by being disabled and entering the scene, that we were consenting to remaining fetishized. And it was very bizarre. A lot of what I ran into was a very confusing clusterfuck of like ableism, fetishization, biases about our ability to consent to things, which just because we're disabled doesn't mean we can't consent to things. It is harder to actually have informed consent with a disabled person because there are so many other more moving parts, and or in some cases not moving parts, depending on how dark your humor is, where we're talking about things that may be different for us. But that does not mean that all of us are like unable to consent, which I think some people actually inferred as being extra hot, which is super problematic on many levels. And I feel like we have to be very aware of the line at which it becomes ableist to start to infantilize us in our ability to consent, or infantilize us in our ability to understand things. Like, just because it's more complex for us doesn't mean that makes us or that means that we're having trouble understanding. It just means that it's more complex for us in our bodies because we have different anatomy or different concerns than you might. So just because it is harder to understand what our limitations or issues within this particular scene might be, doesn't mean it's okay to infantilize me and like explain it to me like, well, haven't you talked to your doctor about it? Isn't this something you should be aware of? I don't fucking know. My doctor's not even aware of half the shit that goes on in my body. He just shrugs. Like, how the fuck would I know? Like, I have no idea how some of these things are going to affect me, and I'm sure a lot of disabled people are the same way. Don't sit here and act like I'm somehow unaware or like unable to consent appropriately. That was something that actually really irritated me in some of the literature I was reading on it, where it very much did come across like almost like victim blaming, like I should know, or isn't that something you should have known before getting into kink? That's not that the same could be said about people who are perfectly healthy too. Like you may have thought that you were perfectly healthy, but like, isn't it quote unquote your fault? Like, shouldn't you have known you had heart issues before getting into this? I don't know. Some of what I was reading was super problematic to me.
There's so
Okay.
much you won't know about until something happens.
Yes. And that is actually another thing we were discussing, like how you don't necessarily know what's going to be okay for your body until you try it. And one of the suggestions I actually thought was really interesting was there was a whole discussion. I've had a blog about it, a whole discussion about masturbating as a disabled person. And part of it was learning how your body will react to certain stimuli that you may experience during kink that you would not normally experience in your day to day life. And I think that's actually really interesting as a topic because I think that it is really important to know like how you're going to like things and experiment on your own. I think we were talking about like shibari and things like that. Wouldn't recommend, choking yourself at home for safety reasons, but I think like as a disabled person, like finding out what your tolerance is, especially if you have anatomical differences, such as that your throat might be more prone to closing up, or you have already had swallowing issues and you're not sure that you're actually going to be able to be choked during sex. You can try like adding pressure to your throat at home just to see if like what you can tolerate. If you figure out that you're having a really strong gag reflex with minimal pressure, maybe you shouldn't be trying to implement breath play into your play when you have a partner. Just tell them that you're aware that you have sensitivities and you don't think this is something that you should get into. I feel like there's a lot of things that implementing masturbation techniques at home as a disabled person could be really beneficial to helping to learn what your limitations with your disabilities are. But not only that, it's also really important for people who are not disabled to learn what their limitations are. I think a lot of this, there's that crossover there.
Yeah,
What do you guys think about that?
we've discussed that before. I think like going slow, especially if you're new to things, like always
Oh,
test things
yeah.
out like slowly in advance. Like yeah, as much as you can, do it alone. Try it alone.
Hmm.
Just to get used to what like I think you mentioned it. The different sensations that are possible and what might happen, and see how much you
Yeah.
can take and how well you can take it, and don't just jump straight into the deep end. Don't go from like, oh well, we did doggy in my last relationship, so now I'm gonna let this total stranger tie me up in a dungeon and gag me, and whip me until I bleed. Don't
Yeah.
jump straight
Maybe
into.
yeah, maybe
There's
not.
no rush. There's no rush.
Yeah. And if somebody's rushing you, run the other fucking way because that person isn't safe to be around. You should
And that's
never feel pressured by a partner.
and that goes even doubly more so if you have a disability that's going to
Yes.
affect your health or your ability to do these different things.
Yes.
That makes it even more important.
Correct. Absolutely correct. Um, what was I was about to say? Wow, did I actually just lose my whole thought that I had there? I
I
had a
can
whole
help.
thought queued up and it's gone.
What from?
Oh,
Oh, go
I'm
ahead.
sorry. It just popped into my mind. One thing that actually did come up a lot is I know in our community, our BDSM community on Facebook, this comes up a lot too. There is a very, very common condition called hypermobile EDS. It is the most common form of the EDS family by far. And
Ehlers-Danlos syndrome. Yeah.
yes, it is the most common form. And I think I've had this discussion. I am technically diagnosed with HEDS myself. My joints do some weird fucking shit. And not the sexy kind of weird shit, like I hurt myself in incredibly impressive ways. Like I sprained my wrist closing my car door last year. Didn't do anything special. I just shut my car door and I felt the tear. And I was like, cool. This is very me energy. Thanks. But yeah, like with this, I have to be acutely aware that I can be folded into weird positions during sex, but that doesn't mean that I should be.
Yep.
Just because I can doesn't mean I will not be injured in the process. And while
Yep.
that could be spicy fun for 5 minutes, I guarantee the 6 months of recovery is not spicy fun. It is not a good time.
Funnily
It
enough,
is
on the
very
funnily enough, on the quick test for EDS, the symptom test, I think there's
the
like
bait
a
and
nine
scale.
point check. Yeah, I have
Yeah,
like 5 or 6 of the
I have
notifiers for you.
I have a perfect score, not in a good
Nice.
way. Not in a good way, but I have a perfect score. I actually outed myself here. I have custom braces for my knees and ankles. I literally walked into the room where my rheumatologist was sitting, and this man had never seen me walk before because usually he comes into the room after I'm like checked in, like the nurses check me in and stuff. He was sitting there, and I walked in, and this man looked at me dead in the eye, and he said, you walk wrong, right?" And I was like, thanks for the new Thanks for the new insecurity. I didn't know I needed one, but you just installed the latest model. Thank you. I did
I feel
not know I walked with.
I feel like EDS is, well, I don't know whether it's just become more common in like the last 20 years or
It
it's just
is. I can
more known
actually
about.
answer this one. So hypermobile EDS, I have mixed feelings on whether or not that the current diagnostic score or course is appropriate because I think there's a lot of people who are misdiagnosed with it. I would argue that the majority of people who think they have HEDS probably are more so on the scale of the hypermobile spectrum disorder, the HSD. I have reasons for believing that. For those who do not know, I have degrees in biology with specialization in genetics. I find it kind of hard to believe that of all of the EDSs out there, there are several, that there's one that is not just not rare by any stretch of the imagination, but it is actually apparently extremely common. There's some literature that suggests like 1 out of 600 people have this extremely common form of hypermobility. And for me, it just beggars belief that like there's just one ultra common form of this disorder
Well, it's
and
like
like everything else is super rare.
if you don't have it badly enough to the point where it can fuck up your digestive system, which is like the
Yeah.
very bad end of EDS. Like
Well, no,
you
that
could be
is not
walking around and not
true.
know it.
Vascular EDS is the one that can actually shred your aorta. So, I mean, I would argue that that one's probably one of the like big baddies
Oh
of
well,
the EDS.
there you go then. Yeah,
Yeah.
but
Like
like
if you
unless you
have,
have that, you might
yeah,
not know.
exactly. But like even if you have it, you probably won't know until your aorta shreds. Kind of comes with the territory. A lot of people don't find out till later. That's how some people get diagnosed with things like Marfan syndrome and vascular EDS, classical EDS. One of the big warning signs is frequent injuries. Like I actually did not know that I was. I mean, I knew I was hypermobile, but like I didn't know it was like clinically hypermobile or that it meant anything. I just knew I was flexible, and I always just was like, yeah, I'm flexible. What I didn't know is that was why I was having frequent joint injuries. I was famously that girl who was always on crutches for whatever reason, and then would injure myself on the crutches, and therefore I would just like yeet myself around as best I could in an air cast with no crutches because I was falling when I was on the crutches and hurting my shoulder too. I was always in some sort of cast or in some sort of boot. And one of the things that came up is like before I was diagnosed with hypermobility, do you have any idea how many weird sex injuries I got? It's not even like I was
Yeah,
doing anything
I
that's like
can.
insane. But
I
like,
was gonna say too, like that's
yeah,
especially as a bottom, someone who kind of to a degree wants to be folded around into little pretzel shapes. Like that's so
yeah,
important for you to like be aware that you have that and to be able to inform your partner about like what that means and how to be careful with it, and that you don't like
yeah,
seriously hurt yourself.
yeah. And like my scale of like, ow, this hurts is kind of fucking broken because I do ow, this hurts on a regular basis. If you've ever been on a voice call with me and my server, I popped my finger out of socket while putting trash in the bin the other day. And I said, ow. And then I realized, oh no, ow, that really hurts. And I then laughed hysterically for a couple of minutes while I dealt with the pain because that was just how I was processing it. And then I popped my finger back in and I was like, that sucked. And I was ready to move on. I just laughed hysterically the whole fucking time. But like that is the kind of thing that I do when I respond to pain. Like I don't have a proper response because I'm used to a high level of pain. Therefore, I will have a very odd and atypical response my partner may not recognize as, ow, that really fucking hurts. I don't think that's good. And I have to have a way to communicate with that or communicate that. And sometimes I can't actually communicate with that because I'm in subspace or, something's preventing me from speaking, say a gag. I need to have a partner who is not only aware that these things are possible for me, but also is going to look out for it and look out for atypical behavior where I may be more distressed. And even if I can't communicate, be able to see, hey, something's going on. And she's not able to say anything, but clearly something has gone awry.
Yeah,
And
like,
if my
I'm not.
partner can't recognize that me laughing hysterically while they're fucking me is probably not because they're laughing or they're fucking me, it's probably something going on.
Yeah, and that's probably one of the places where, coming up with one of those dry, very unsexy but very important documents of being like, hey, here's my health issues and how they might
Yes.
impact me during kink and sex and whatnot, and please be aware, I can have these symptoms and this could be wrong, and please, if you spot anything like this going on, or anything off that could pertain to one
Yes.
of these things,
If
please
you
stop. Ask me
even if you even think something's off, please do a vibe check. I call them the vibe checks. Like, I would prefer, if you feel any level of discomfort with how I'm acting, that you do a quick vibe check to make sure I'm good and to make sure you feel comfortable continuing if I tell you something's wrong. If I tell you that I don't feel okay, but I'm okay to continue, but you don't feel safe continuing knowing I feel that way, you have that right. And that right to go, hey, I don't want to hurt you. I don't feel comfortable with the fact that you are already feeling this level of discomfort. I don't think I want to push it this way. Either I want to fully stop, which is valid, or I want to try something different, and you tell me if this is any better or worse, and we'll go from there. And that's a really important aspect of kink, is just because you feel okay to continue, your partner may not feel okay to continue if they knew that that was what you were reporting, if that's what you were feeling. You have to be able to communicate these things. That's part of the use and function of a safe word. Like, hey, I want to let you know that while I feel okay to continue, this is what's going on. I think we should watch out for this. And if your partner does not respect that, get a different partner. That partner sucks.
Yeah, I agree, Mouse. Also, hi, everyone.
Hey, Drow.
Welcome back,
Heyo.
Drop.
Yeah, I'm sorry, I just got home.
No, it's okay. It's just, some of you know there was a whole thing in the Facebook community this week about safe
about
words.
consent,
safe words.
and fun
Yes.
stuff, yeah.
Yes.
Mhm.
And this is something, it is coloring my discussion tonight because I am still frustrated about this. If you think safe words are not necessary in kink, you should not be in kink. Full stop.
Oh, no,
If you think
I
it's,
agree.
yeah, I just, oof. But the more I thought about it, the more I thought about like how critical it is for anyone with health issues, the more upset I got about it. Because, like, you don't know you have a health issue until an emergency happens half the time.
Yep.
And it is just so critically important to be able to communicate when something is wrong. And sometimes it's not something that you think is wrong. Sometimes it's like, something is off. I just want to let you know that, my chest is fluttering a little bit, and this is not typically something that happens. And I just want to let you know that this feels weird to me. And if I start tapping out, be aware that that is probably what is going on. And you need to be able to communicate these things. And it's not sexy to communicate these things. In fact, you should feel comfortable enough with your partner that you are having a scene with to be able to communicate these things without fear of them being turned off.
That goes on mentally too. If you have a triggered panic attack, and people have PTSD to certain things. If a boundary was crossed, how are you going to communicate that without a safe word?
Exactly.
It doesn't allow the scene to end, which isn't safe at that point.
Exactly.
Agreed.
Exactly. And the thing is, it's not just not safe for the person who is afraid. And this is something that I shouldn't even have to say. But if you are the person who is denying that safe word, that also puts you at risk for legal issues. Do you think anyone is going to find it not rape if you get called out for rape when you were telling them they weren't allowed to tap out? Like that literally makes it rape. So
yeah, exactly. That's and that's what we were. I mean, that's what the whole argument was recently about CNC and stuff, like, with safe wording and shit. Like, that was the whole point, like, of our arguments. Like, we're like,
well,
no, if you like, people that that just pissed me off. Not gonna lie.
Yeah. Yeah, I definitely, I was definitely very involved in that
It
one.
was, yeah, I was heated.
I went head to head with that guy on his post. He ended up blocking me because, yeah, I wasn't backing down. But the big thing for me was the more I thought about it, they were making arguments like, well, I trust my partner to have my best interest at heart. And if you don't have that experience, then I don't know what to tell you. And I'm thinking to myself, like, whether my partner has my best interest at heart or not, it is unfair and even cruel to expect my partner to be able to read my mind and know when I'm thinking something is off without them being able to communicate to me. Like how like outside of the realm of humanity are you that you think that your partner should be able to read your mind and know when you're thinking something might be off, or when you're nervous about something, or when you are having an experience within your body that you don't know how to quantify, and all of a sudden you're finding you can't speak and you can't communicate and your body's not doing what you want it to? How the hell are you supposed to tell them in any other way that there's an emergency without having
Right.
some predetermined vibe check in place, like a tap out? Safe wording is not just a word, it is also any pre talked out way to communicate there's an issue. Sometimes that safe word is going to be nonverbal. It's going to be tapping 3 times in the back or tapping 3 times in the bed, like, just flapping your hand specifically. Sometimes it's going to be like a series of blinks or like really hard blinks. It's going to be something. You have to have some way to communicate built in. And if you don't have that, you are not in a safe situation, and therefore consent goes out the window. If it is no longer safe, then you are no longer able to fully consent to it. It has to be safe, sane, and consensual for it to be within BDSM and be within a consent framework. And those things are just critical. If you start losing something like safety, I would argue really strongly it's hard to say that you are still within the realms of BDSM. I would argue very strongly that you are getting very closely into the realms of just pure abuse. And especially this is true of people with disabilities and health issues, anything that changes your body's function. And you never know when your body's going to have a different level of ability week to week. You may have a condition forming, you may have an autoimmune disease forming that you don't even know about. You could have developed cancer for all you know and have no idea when those symptoms are going to show up. Health is never a guarantee. And you always have to make room for these things to happen. If you haven't done that, then it is not safe.
All right.
Anyone else have any input on that?
I don't know. I think we made it really clear.
Honestly, you've covered all of the points that I was even thinking of making. So you're good.
Yeah. This is something I'm very passionate about. For those of you who do not know, before I became a kink page, my social media existence was chronic illness advocacy, disability advocacy, and medical misinformation debunking. This is what I did. Going head to head with ableist people who were just doing unsafe things for disabled people, about disabled people, speaking over disabled people, not giving disabled people a say in their own lives. So this is something I'm intensely passionate about. And then we have this crossover with kink. And I already have an intense level of importance placed on consent outside of kink in terms of disability and in terms of whether or not somebody with a disability should have say over their ability to control their own medical rights and information. These are all things that are critically important to me. So this is something that I get intensely passionate about, and I know that it may be a lot for some people, and I'm not going to apologize for my intensity because that's what makes me me. I am just a very intense person. Sometimes it's for funny reasons, and sometimes I'm just like, no, I will absolutely go the fuck to war for disabled people and for people who need representation who don't have it. And I will just die on that hill every time. And one thing that I was really uncomfortable with in general was the amount of times that I saw consent issues for disabled people being just tread over. And then to see the same thing occurring on our community just this week was really, really not good. And I was very unhappy.
Yeah, which is very understandable when someone's trying to give out, information that is very much raw.
it's not just wrong, it is just intensely dangerous and harmful to the community at large. And anyone who was trying to get into it, they would, and many of them did state that they felt incredibly unsafe, because one of the things that gets people into the community is knowing there are safe words and ways to back out if things get to be too much. Knowing that there is a security there that a lot of people who are into more vanilla dynamics don't necessarily respect, but something that is pivotal to us, it's a relief to many people. It's something they know they can fall back on. Like, at least when I'm in this community, they have a high regard for consent and how I feel. And to see somebody who is a member of this community be openly touting how that they think that safe words are a sign of somebody who's new or not established or hasn't been around long enough or just doesn't know what they're doing, that was something that was really jarring for a lot of people, especially people who are newer to the community and don't know how, holy shit, that's fucked up, the rest of us saw it as. It can be very scary.
So what else? What's the next subject here, Mass? What else can we talk about when it comes to accessibility and kink?
Well, we were talking about, I know that Kat was just talking about the accessibility for toys, different handholds and grips that she was looking at.
Mm-hmm.
Did you want to talk about that?
Yeah. Few things I was just looking at today. One that kind of surprised me, was pretty brand new to me. Yeah. Using bondage tape actively you could use that on different pillows. You can make grips on it for your toy. Since it only sticks to itself, it doesn't leave any residue or anything. Obviously, probably not internal safe there, so
no.
Keep that all in mind. But using that to actually get things in place if you need it at certain positions, making those grips so it's easier for you to hold, because sometimes grip strength just isn't there, or you shake. That can happen a lot, especially if a person's nervous too. It's helpful in all regards there.
I will also add that is super beneficial to not just people who have disabilities. Like, there's a lot of people who, for various reasons, will not be able to hold a toy at a certain angle for very long. Maybe they'll have, arthritis or hand weakness, things that just come with age, because a lot of people in our community right now are millennials, such as myself, who are getting to the point where we're starting to have things like arthritis. And whether or not you consider that a disability is up in the air. I personally would. Not everyone would, because they don't want to self-label themselves that way. But hey, if you're having a hard time holding a wand, there is nothing wrong with finding a way to make that more accessible for yourself. Anything you can do to improve your quality of life and your quality of your experience within kink to make things more accessible is valid. Accessibility is not just for the disabled. It can make things better for everyone involved. There's no reason to say that accessibility just has to be for the individuals who are disabled. If you find that a tool that is used to make, just gripping a toy easier for somebody who might have mobility issues, but you find that it makes your quality of life and your dom or sub's life better, there's no reason not to implement that.
Some people, like, if the off-the-shelf pillow doesn't help, so they make the pillows that can hold different vibes and things like that. But it doesn't mean that that's going to be right for you if you have to hover over that on your knees, things like that. That doesn't mean it's going to be right for you resting in that position on your hips.
Exactly. This is another big thing that comes up too. Not all subs or doms are the same height, and that's something else that has to be made accessible. If you are quite a bit shorter than your dom, might be a little hard at times for your dom, especially trying to get down that low, because you're going to have much shorter thighs than they will. It might make it easier for, you guys to implement using a pillow or some sort of tool or some sort of Couches. We were talking about the
Tansic.
lounges.
Yes.
Yeah, things like that. Swings could be essential to get you into the right angle because size difference can be hot, but it's not necessarily something that makes it accessible.
Not every penis is shaped the same.
Exactly correct. This is something I was joking about the other day. I have short little leggies. I do. And it's hard for me to be on top because my legs don't usually reach all the way to the ground when I'm straddling somebody because I have got short little legs. And if I'm with a bigger partner, which I usually am, I usually have to be squatting to be on top. I can't do it any other way. And it's something I joke about, but it is something that I have to be aware of because I'm usually with bigger guys, and therefore it's harder for me to do things the way that some other girls would. And it's something that we do innately. We don't necessarily think about it as an accessibility thing, but it is an accessibility thing. If you are shorter and or taller, and for whatever reason something's not working between you and your partner, that doesn't make you not a good fit. It just means you have to find a way to make it work for you and your dynamic.
The thing early on I figured out, if you don't have any type of headboard to hold on to, because bars, super helpful in any type of regard. If you are on top, you need something to hold on, even in doggy.
Exactly.
Didn't have a headboard for the longest time. Couches helped.
Yes.
You have something up higher to hold on to.
Also, if you have a partner who is really into grabbing the headboard, make sure that headboard is secure. You have no idea how many times I have been injured by a loose headboard.
Some people just slide it right back there. It's not the same.
Yes, I have had some oopsies occur, and it has been traumatic. I didn't know it was going to move. Jesus, why would you do that to me? But yeah, it's one of those things that people don't think about, but accessibility is not just disability based. And when I was suggesting this as a topic, I was thinking about it primarily from a disability standpoint. But the more I looked into it, the more I was like, this is already something that we do and should be continuing to implement within our community. But expanding it to include accessibility for disabled members of our community is of the most paramount importance. And it's already something we do, so it shouldn't be that much harder to implement these things on a broader scale for people who have other differences besides height, besides physical limitations. You may not have a disability that makes it hard for you to breathe. Maybe you're just a little bit out of shape, and there's I'm not going to say there's nothing wrong with that because I'm sure your doctor will disagree. I think it's totally fine. We all get out of shape sometimes. If you're just having trouble with, keeping up the balancing, invest in one of those really cool bouncy stools. Just do whatever you got to do. There's no shame in using devices and toys and any assistance device you find helpful to make sex more enjoyable. Accessibility is not something that anyone should ever be ashamed of, and it should be far more normalized than it is. At least in our community, from a BDSM standpoint, it's already something that we largely accept. And I just think we should expand on that even more. If there is anything you need to make sex more enjoyable or the BDSM experience better for you and your partner in whatever way, embrace it. Just do what you need to do. Find a way to make it work. There's a lot of really cool advice areas out there. There's a lot of really cool grips that you can make out of tape. There's grips that you can buy from certain websites to make holding things easier. There's a lot of toys for masturbation even. Sometimes it's hard to ride a dildo the way you want to. There are toys out there that will hold the dildo for you to make it easier. Just get what you need to, and if you can't buy it, there's probably an instruction video out there to make it at home. There's some weird ass instruction videos out there. I have seen a lot of weird stuff that I never thought of. Well, I've never thought about trying to make that before, but I found the video on how to make it, and I had to really think about the implications of what that meant. How and why would I want to make that? But I'm going to keep it just in case, because I feel like one day I will probably have a use for that. This really niche video. But I'm going to keep it. You just never know. And anything you can do to make your life easier, just embrace it.
Sex is as important to human life as like food for a lot of people. So if there's
Yes.
a way to get something done,
Mhm.
so when it comes to sex, someone's gonna
Get
find a
the
way.
job done. Whatever you need to do to make it more enjoyable, there is no shame in finding ways to make it better for you and your partner. And that includes finding new and creative ways to spank, new and creative ways to beat the shit out of each other if that's what you're into. If you have found a way that is something you guys have both consented to, that makes it easier on your wrist if you're starting to have wrist pain from flogging so often. Like if that flogger is really doing damage to your wrist, find a different way to impact or to have the same type of impact, but in a way that's going to be easier on your joints.
Oh, I don't want. Sorry.
What you do,
I did
what
not
you
quite
do
hear
is
what you said.
you spend 12 years getting a PhD in robotics, and you build yourself a sex dom robot who will beat you on its own without you having to. That's what you. Anything
Counterpoint,
you need to do.
counterpoint.
We
The newest
now
thing
know
in
what Will dreams
BDSM,
about.
the new thing in BDSM isn't going to be build a better mousetrap. It's going to be build a better spanker.
Yep. And
Also-
and hey, I'd make a lot of money if I did.
You probably would.
I'd market the shit out.
Yeah,
Sorry,
I mean, imagine.
My and
Robots
Mouse
are
is
becoming doms.
me and Mouse's new kink is gaslighting Will.
It really is.
New?
It really
That's been
is.
this entire fucking podcast.
I don't know what you're
I don't
talking
know.
about.
That really started after the monster fucking episode, honestly.
You guys can't
That
gaslight
was,
me.
that was a beautiful episode.
I will not let you gaslight me.
Well, too bad we already do it all the time.
Next
Yeah.
little bit, Mouse. It would go a lot into aftercare as well too, wouldn't it? All.
Yes.
Mhm.
Oh yeah, for sure. Different people's disabilities may result in them having pain in different areas, and while that may not be a hindrance for them while they're in the scene, it would be really, really important to make sure that that pain does not become out of control after the scene. If you know that your sub has an issue with chronic pain, maybe part of their aftercare could be the first thing you do is you go buy, get them a drink, their favorite drink, the pain medicine that they usually take in the evening, and start to wind down for bed together by doing whatever you're going to do aftercare wise. But that could be an important element of caring for your submissive or your dom. If you're doing aftercare for your dom and your dom has chronic pain, make sure that they have what they need too. This is very true. There's a lot of people with chronic illness who don't necessarily consider themselves to be disabled, which is valid. You don't have to be disabled if you don't consider yourself disabled, but your needs are just as valid as anyone else's. But if your sub or dominant is chronically ill and they would benefit from having their medication on hand afterwards, there's no reason part of aftercare isn't going to get their meds. No shame in that. Nothing wrong with that. That doesn't make it less sexy. In fact, it would probably be a lot more sexy if you actually were taking care of them enough to know this is something they would benefit from.
Mhm.
Because they're going to notice when you remember things like that. And that's something that a lot of people have probably not experienced from a partner. Speaking as a chronically ill girly, I can't tell you the number of partners that I've had, BDSM or not, who genuinely had no fucking idea how I would care for myself if I was having pain, like what steps I would take. And a partner who actually knows that and asks me about it, they don't even have to do it for me. If they ask me about it, I am automatically like, I'm impressed that you remembered enough and care about me enough to remember that this is something that I would do if I was having back pain or something. Trust me, it works. It helps. Chronically ill girlies and chronically ill guys and theys and whoever else may be chronically ill will very much appreciate if you remember what may be essential for them if they're telling you that they're in pain, or if they usually tell you they're in pain after a session. Make sure that their needs are met.
And I feel like those needs can also change session per session, and that's even normal ones too. If you are trying something new and you've got a crick in your neck, things like that, that aftercare will probably change even normally.
Exactly. If this is something you've done with your partner before, and you know that they oftentimes report that their shoulders really sore after you were holding it behind their back for an hour, maybe you should actually go get a heat pack or an ice pack for their shoulder, whatever helped the last time. be preemptive about it too if you can predict that it's going to be an issue. Yes, it can vary time to time, but sometimes even your partners who do not have diagnosed medical conditions, taking care of their needs, especially like physically, is something that a lot of people may not have experienced in their relationships before, and it can be extremely important. Make it accessible to them by making it something that you value caring for them physically. If you're going to do something for them physically, be ready to care for them physically too. This is even more important, especially for people with disabilities, because maybe you need to like really make sure that they don't have anything wrong with them following. Like if you're like me and you have hypermobility, you may need to actually do a physical check. Like, yeah, my shoulder was kind of hurting, but like I didn't realize 1 hour later when we were done cuddling that I actually can't move my shoulder. Didn't notice that right away. Knew it was hurting, but like I would not have noticed. Like maybe after I do certain things within a scene that would involve like my shoulder being like shoved behind my back. Maybe I need to actually do like a mobility check on my shoulders going forward. And a dom that would recognize that and remind me to do that, I would appreciate that a lot. Because if I'm in subspace after a scene, I'm not going to remember to do these things. Be really nice to have somebody who would actually help remind me. I barely remember to do these things, but I'm not in subspace.
If you're coming down from subspace, and sorry, words are getting jumbled. Thing I was just thinking of, it could be also as simple as helping that person clean up if they're like prone to yeast infections, things like that.
Oh, yeah. Absolutely.
Some people are more likely to. It's just how bodies are.
I have very traumatic stories about before I got diagnosed with my immunodeficiency. Mm-hmm. I didn't know that UTIs could get so bad that you have blood clots that prevent you from urinating. I do now. I didn't know before. I had no idea why I was in such excruciating pain. But once I figured out that's something that I have to watch out for, not only do I have medication to stop it, but it's also really nice to have a partner who will remind me to make sure I'm doing all of the extra steps my doctor's prescribed to help me prevent these things. UTIs are very common for women after sex. Pee after sex, it's very important advice, but that's not necessarily enough for everyone, especially if that person has kidney disease or a history of bladder infections, which are very severe. They may have special advice from their doctors to take care of it, and being in subspace, making you that extra vulnerable, can sometimes affect your ability to remember to do those things, especially if after sex you're having a lot of pain, because a lot of us engage in some really rough play. If you're in a lot of pain, the first thing you're thinking of is probably not going to get up to go pee and take care of all of your needs to prevent that infection. It'd be really nice to have a dom or a caregiver or what have you that will remind you to do those things. Part of aftercare is sometimes just things like that some people might find gross or TMI. Aftercare doesn't have to be sexy or cute. It's just care. And for some people, that is not necessarily the sexiest thing out there. What do you guys think? Like, what other things can you guys think of that might be important to implement?
I think just pulling from random knowledge that I have, things like setting boundaries beforehand as well. Like it could be relying on a health issue of why that person needs you to wear a condom, not just fear pregnancy or STDs, but you can be allergic to semen, just basic things like that.
Another very important thing, some women cannot take birth control. Not just women, of course, men take birth control too. Some people cannot take birth control, and they will need you to actually make special accommodations for them. Some people may be taking birth control, but be on antibiotics. And antibiotics can actually nerf the effectiveness of your birth control. And a lot of people don't know this, or for whatever reason, their doctor didn't tell them. And that's how accidental pregnancies can happen. People just don't know that their birth control won't work when they're on certain antibiotics. So make sure that you are communicating these things And you don't have to be disabled to be on antibiotics, but if you're like me, part of the reason that I didn't really have any benefit from taking oral birth control is I was on so many antibiotics that it never had a chance to work. And I didn't have a whole lot of partners who were super understanding of the fact that I maybe didn't feel safe having sex when I was not able to be taking my birth control. And, you know, it was one of those really difficult situations. Like, I understand that it's not something you're worried about, but I'm worried about it. So you're going to have to suck it up. But now that I'm like more into BDSM than I was at the time, like I'm into BDSM now, but like when I was first discovering these things, I was like an 18-year-old baby, new to the scene, was only just starting to dip my toes into BDSM. And one of the first experiences I had was I was trying to pull back and like not have as much unprotected sex because I was becoming aware that I wasn't able to take birth control, and I was starting to feel pressured about it, like it was something that I should find a way to fix. But I didn't have a diagnosis at the time. I didn't understand why I kept having these issues with my antibiotics stopping the effectiveness of my birth control. And it was like I was saying earlier, you don't necessarily know. I thought I was healthy. You don't necessarily know that you're not healthy until you know for sure. I had no idea at the time that I had a genetic immunodeficiency that was preventing me from being able to be off antibiotics long enough for birth control to work. I had no idea. And that can be the case for many people. And accessibility isn't just for the people who know that they have illnesses. Anytime that there is something going on that you need to make adjustments for, accessibility is for you and should be for you and should be available to you.
Yep, you're not wrong. Oh, and it seems like Drow has dropped, but that's all right. I was going to say, it has been an hour. I'd say we've exhausted a lot of this topic. So it's time to discuss what are we doing next episode?
That is a great question. I think we brought something up last week, didn't we?
We always
Did we
do
have another?
this.
Yeah, I think we suggested something last week.
Oh, geez. I can't remember what it was.
Did we want to talk like maybe about old guard versus the new generation and how these two ideologies conflict? Because we kind of touched on it today, and I was venting a bit about it before we started. And I think it could be an interesting, not necessarily case study, because I don't think we're going to go that in depth, but we could actually talk about like what the differences are and how we may not necessarily see eye to eye.
Yeah, we totally could.
Because I know this is something we've discussed, I think, within the podcast, but I think some of the discussions have also happened like after, during, you know, the period that we sometimes sit here and just bullshit.
Yeah, I think. All right, yeah, so we can do that in 2 weeks.
It's gonna be an episode of me having the ick. I got it.
Yeah. Trust me. I had the ick all week.
That'll be March 15th. We're going to talk about that old guard versus new guard. All right, everybody. I hope you all enjoyed watching. Again, if you're catching up on this on YouTube, there are links below. If you'd like to look at those links and you're not watching on YouTube, go Google Starbright Podcast. We come up and there's links there. Join us on Discord if you want. Chat with us live. Ask us questions. Whatever you want. And that's been today's episode. Have a good one, everybody. Have a good night.
Bye, guys.